often childcare professionals don't necessarily have a connection to the exchange. They haven't necessarily shopped for health insurance through the state-based marketplace before. And the data sharing component between the two entities has been really important because DCYF can tell us, hey, here are the 40,000, employees at licensed childcare facilities in the state. And we can turn around and tell them back, 12,500 of these people have coverage through Washington Health Plan Finder already. So they have a known source of coverage, and let's do what we can together to target the remaining employees who don't necessarily have a known source of coverage. And some of those people may have employer coverage, they may be covered by a spouse or a partner, but some may be the exact people that we're targeting with this program. And we can see with our metrics, DCYF pushes out an email reminding people about the availability of this program, or they push out messaging to new people who are kind of newly licensed and joining the workforce in Washington. And that messaging directs them to a statewide outreach and enrollment partner that the exchange works with. We work with Yakima Neighborhood Health Services. They're one of our lead navigator organizations, but really in any state, it could be any entity that helps you do statewide outreach and enrollment for your healthcare. And they push out an email and we see the calls and the emails spike at Yakima. So we can see that it's making a difference to do sort of repeated and continuous outreach from a more trusted state partner in this area. We're also working with local brokers and assisters and sort of our community engagement partners that we routinely work with around healthcare to help spread the word. But the partnership of DCYF pushing out messaging and then Yakima Neighborhood Health Services following up with people, doing proactive outreach, helping people who call get through a healthcare application, which isn't necessarily the easiest application, really providing that kind of on the ground experience, providing language assistance services. They support over 200 languages, which has been pretty important. We look at the population of people who are being served by this program right now, and 22% of them have a non-English language preference. So I think there's been having sort of bilingual, multilingual, and telephonic interpreter services available has been a key learning as an important part of the outreach that they're doing.
So we do work really closely on outreach. And so one of the things that we do, and this is maybe a little too in the weeds, but anybody who passes a background check is actually getting outreach. So we're, again, looking at that facility and provider type. And if they've passed a background check, we are communicating with them to let them know that this is available to them. There were some initial outreach that happened in September. And we now send monthly communications to folks. And so really worked in the beginning with our partners at the Health Benefit Exchange to really identify sort of who we were going to be communicating with and working on that communication flow. And then I think one of the things that's been great about working with the Health Benefits Exchange is sort of as they're seeing who's coming through the door, they can reach out to us and say, hey, we want to do another push of communication. Let's think about how we might actually get to some of those actual employer and the directors and our trusted partners who can give some more information to those individual staff. And we're actually right in the middle of working on a campaign around that right now. So we have reached tens of thousands of childcare providers through that outreach. And then I think the other piece that Joan can talk about is just the importance of the navigator. So I think DCYF sending that initial outreach is really important, but I think we know sort of that personal follow-up and connection is also really important.
I will add that one thing that we've offered to employers in the childcare space is to have a local navigator come to their workplace and or set up kind of individual appointments, sort of on the clock appointments, where an employer can kind of make space for their employee to talk to a navigator to do the work of signing up kind of during their workday or as part of their workday, so that it's not necessarily on the employee to try to find time in their day or kind of do it later at night. So that's one kind of idea that we think has been helpful, is that if you have an employer who wants to help their employees get covered and wants to carve out time for them during the day to do that, we can make a local navigator or assister available during that time to try to help streamline that process even more. So this has been a really insightful experience for us in terms of lessons learned in reaching out to communities, and to sort of providing and gaining community trust around a new program that's providing a pretty substantial amount of premium assistance. We've had some childcare workers, say like, this is too good to be true. This program must be a scam. Like, or it's like, oh, sure, I get 2 months free and then you charge me later. We've had our outreach workers have reported back to us that really trying to figure out how to sell and market healthcare to an audience that doesn't necessarily know who you are and what you're selling in this space can be really challenging.